And for the moving on, like parents generally ask how this will be given to the patients, how will they actually get it? And for that, it's an online talk from Dr. Peter Spazzapan, who is administrating the therapy to the patients, and it's titled as Neurosurgical Procedure for Bilateral ICV Administration of URBAGEN Gene Therapy.
Hello to everyone. I'm sorry not to be there with you, but I hope to be able to explain all our surgical aspects and experiences with you with this short presentation. So, surgical procedure of bilateral intraventricular application of URBAGEN. I must admit that at the beginning of this project, when I was first invited to join this beautiful group, I really felt a little bit scared because there were so many concepts and words which I absolutely did not know, like these concepts of transduction, vectors, adenoviruses were completely unknown to me as a neurosurgeon. So I really needed to study at the beginning and to see actually what we did know from the literature. And what we did know is that we can insert drugs, gene therapy in the central nervous system through different routes. Maybe the easiest one would be the intravenous injection, but we wanted to go directly into the central nervous system. And here we see the 4 ways which we can use: the intrathecal, it means through a lumbar injection; the cisterna magna puncture, the intracerebral ventricular, and the intraparenchymal. The dose of vector which we would use, for example, for an intravenous application was much higher, and we absolutely were not sure whether this would reach a high concentration in the central nervous system. So how did we plan and decided for a bilateral ventricular application? We knew that the surgical risks were justified, but by the therapeutic endpoint of what we wanted to reach, we knew that we would avoid eloquent regions of the brain through this ventricular access, and we knew that by means of neuronavigation, we would absolutely have all the chances to hit the ventricles with high precision. So how did we write the protocol? We decided to split the injection in 4 parts with a slow injection to avoid sudden changes of intraventricular pressure, and also to give the chance and the time to the gene therapy to spread slowly around the CSF spaces. So how did the surgical technique look like? In all cases, the ventricles were really narrow, so we were only able to reach them with the aid of neuronavigation, of electromagnetic neuronavigation. This is somehow shown in this picture on the right side. And how did it look like? Here we see on the left side the planning at the beginning with our neuronavigation machine. Then the small haircut on the right side. The same thing is done also on the opposite side, on the left side. And this is how actually we started with the procedure. The trepination, the 2 small tiny holes in the skull. Then the insertion we see here with this probe of the electromagnetic neuronavigation in the ventricles. Then in this third image, we see the initial release of CSF through the catheter. And then in the fourth picture, we see finally the most important sequence, the injection of URBAGEN in the right ventricle, while the catheter in the left ventricle, you see, is closed here on the left side, waiting for the injection also in this site. This is the final image at the end of the procedure. So what is the role of the neurosurgeon? I really think that this whole surgical procedure is technically not extremely difficult. We know we are often doing much more complex, long and difficult procedures in neurosurgery. But this particular treatment needs to be done with high precision, and a lot of attention must be paid to all small details, beginning from surgical planning, skin incision, exact placement of the two holes in the skull, catheter insertion, and also finally in the end a lot of precision and care must be taken also into the final steps like skin suturing. I like to conclude this short talk with this painting again from Escher, which somehow resembles this multidisciplinarity. We really were we all neurosurgeons were part of a really big process, and we really needed the knowledge and the efforts of all the group, and in the end also all this incredible scientists and doctors also needed our surgical knowledge. So I think really this picture resembles this multidisciplinarity, which is so important nowadays. And I really hope that this approach will continue and that we will reach a lot of successes also in the future. Thank you very much.